A new bill in the state Senate hopes to help hospitals defend themselves against cyber attacks.
That's right. Data from the Connecticut Attorney General's office reveals the healthcare industry was hit by more data breaches in 2022 than any other sector.
Max 61's Bridget Bureau joins us live in studio with a closer look at the bill. Bridget, this is concerning.
Yeah, very concerning, Sarah. Matt, the recent cyber attack on Change Healthcare highlights the need for better digital security throughout the healthcare sector. It also exposes just how vulnerable the industry is to these crimes, which is why Senate Bill 1 focuses on getting medical providers prepared. Connecticut State Senator Saud Anwar wants to help hospitals fend off cyber attacks.
A few months ago, 3 of our hospitals in the state of Connecticut were under a cyber attack. And in some 40+ days, the 3 hospitals were without access to internet, without access to be able to connect internally with the various parts of the healthcare system.
The co-chair of the state's Public Health Committee says the healthcare industry is becoming a common target for cyber criminals, and it's time for state leaders to go on the offense.
And what Senate Bill 1 is looking at is a way to have us be better prepared. And the reality is, if you fail to plan, you plan to fail. And that's what is important for us to act collectively as the state of Connecticut need to do better to be able to plan in advance.
Hackers are lured to the healthcare sector for its digital systems that contain sensitive data, like billing and medical history.
And we should all be eyes wide open. We're dealing with sophisticated and nefarious actors that are global in nature.
It's why industry leaders say they should work together to safeguard patient privacy.
We have to make sure that everyone in the state of Connecticut feels like their personal information is protected and that we're doing everything we possibly can to make sure it's protected and used in an appropriate way.
To prevent cyber attacks like the one at Change Healthcare in February that caused massive healthcare and billing disruptions nationwide.
We rely on data in public health. We rely on understanding where population health is, and we certainly all support that understanding. But we know that it has to be done in a way that protects our patients and protects our residents.
One of the goals of Senate Bill 1 is to hold an annual meeting with state and departments to brainstorm protocols and procedures to ensure that hospitals and other medical facilities are ready for the next cybersecurity event, because it really is all about that preparation, Sarah, Matt.